We can make sure you have everything you need. All right, then, let's get started. Every year, there is a period of time when the current incumbent carrier will provide renewal information to a group. And so when the renewal information came for Windmill School District in March, basically what was on the forecast was that the cost of medical care for Windmill schools would increase somewhere double digits, possibly 11, 12%. That was not an acceptable solution. We just couldn't go forward and take that and put that burden on everyone, because that would carry forward and everyone would have had higher rates as a result of that increase. So what we did, which is a normal practice, is a marketing effort. We went out to the three. We had Humana. They came back with lower administrative costs, but they did not come back with any lower claims, expected claims costs. So we did get a little bit of a relief, but not as much as what we needed. Anthem and United Healthcare are the other what we call bigger players in this market, so they were asked to quote as well. As you can see from the little grid on the bottom, if the top box tells you what their kind of estimate is, and this is a number that's used for what's called stop loss, and we don't have to go into any of that detail, but that's what they think you're going to be at, but they're insuring you up to the bottom number, which is what kind of is happening with a lot of employers these days, where they think that we've got a lot of high-cost drugs, we've got baby boomers needing more care, we're floating somewhere in between annual claims as projected and what the maximum liability is. So for purposes of Whitnall School District's budget, we have to look at that bottom line, because that's the insured place. That's where the protection stops or starts. So you have to be able to pay the bills up to the bottom line. So the best case scenario that came back was the Anthem Blue Cross Blue Shield option, and the reason for that is because of their offer of providing a dual option. And that dual option is that you can have the full state network that you've always had, or for people who are willing and want to take advantage of the lower cost opportunity, they can have their services provided in the narrow, high performance Blue Priority network. So you have what you've had before, and a lower cost option for anyone who can or wants to move to that to get their care. So what we're looking at, what we had clearly with the marketing effort, was savings in the administrative costs, $81,000, and a projected claims savings of about 6% below current. And when we get to a little bit of what that means and what dual option means, I'll let Sarah explain a little more of that. So the job that you have to get to enroll for benefits for July 2015 through June 2016 really is going to ask you to make some decisions for medical on what enrollment tier you're going to take, which plan you're going to take, recognizing that HSA contributions will still be available on some of the plans, which network you're going to take, big decisions. And then for dental, you have a choice of the Anthem Dental Complete program or a narrow high-performance dental HMO with Care Plus. And about 3 years ago, you were first offered a voluntary vision plan. So this is the Anthem Blueview vision plan that you would be able to enroll in. And the enrollment forms basically take you through the steps of making those decisions. So we just want you to all have a bit of a comfort level about a move to Anthem, because you've had Humana for such a long time. Humana did you well. They took really good care of you. Anthem will too. It is the largest health insurer in the United States, has the largest national network of healthcare providers, is innovative. That's why we have had this opportunity to bring dual option to you. And 1 in 3 Americans are in a Blue Cross Blue Shield plan, and that's growing and growing and growing here in southeastern Wisconsin. So first we're going to talk about what it means by coverage tier. In the past, all you've been able to do is pick single or family coverage. So if it was a family of 2, you were paying the same amount as you were paying for a family of 6. So what this allows for is this set of tiers allows you to pick, to have a lower payroll deduction because you can actually pick how many people are going to be on the plan. So obviously we continue with a single plan, employee only. You can now have an employee plus spouse plan, or you can have an employee plus child or children. That means that you just can't have your spouse on that plan. And then the conventional 4th tier is a full family where you have your spouse and your children on the plan. So now the next set of questions has to do with which plan you're going to pick. And now you have 4 options. The reason to give you 4 options is that for some people, they go to the doctor once in a while. They go and get their annual checkup. They might go for some kind of ear infection or the flu, but they're not dealing with a chronic condition. So they're paying higher premiums for something they don't use very much. But they still need some top-end protection, because we don't want to, bankrupt our families by having, if there's that what if, that we want to just, we need that protection. So that's why these 4 plan options are available. The plan 1 is what you have now. It's the same deductible structure. Remember, these are high deductible health plans. Preventative care is covered at 100%, but other than that, you have to meet either an individual if you have a single plan or a family deductible. Then you pay coinsurance until you, in this case, you're paying 10% of the cost of services until you meet either an individual or a family out-of-pocket maximum. So this is the plan that you have right now with the same deductibles that you have right now. Plan 2 increases the single deductible by $300 from the current, the family deductible by $600, and this is in-network. So for all practical purposes, out-of-network doubles everything. So it's the same logic, it's just that you're picking up some more front-end cost. Plan 1, no HSA contribution. Plan 2, there is an HSA contribution. On Plan 3, you're picking up $600 more or $1,200 more single family from current. This plan also has an HSA contribution. And I'm going to take a second to remind you all that you still, with the new plans, the preventative drug copay structure is still available to you. We're going to talk about that in a couple of slides. But you still have $15, $30, and $50 copays for preventative drugs. Plan 4, from current, increases the single in-network deductible by $1,200 and the family in-network deductible by $2,400. So that's the logic. It's just a simple 3, 6, 12 combination for what the increases are from plan to plan. Preventative care continues to be covered at 100%. So I put this slide here because I wanted to just remind you all that go and get that care, because you need to get in front of things. It's always lower cost when you can get into something early rather than having to figure it out later. If you need to manage some kind of heart condition, you don't want to have the heart attack, you want to figure out what the condition is so you're not having that event. So please be sure to continue to, and this group does a really good job. You have high preventative care utilization, so keep up the good work. So now I'm going to turn it over to Sarah to explain the different networks.
Okay. Great. So you do have a lot of decisions to make. So not only do you have 4 plan options, you have 2 networks that we're allowing you to choose. So really you have 8 plans to choose from if you want to think about it that way. So the difference between the networks, Blue Preferred Plus is broad, okay? It's whoever you might think of in southeastern Wisconsin. You're going to have a hard time finding someone who doesn't participate in the Anthem network in that way. So if you wanted to, and it's actually on the next slide, but page 27 in your book would show you the kind of the broad network that is Blue Preferred Plus. So this is, if you're seeing providers, you don't want to, make changes, or you look at what the Blue Priority Plus is going to be and you're like, my doctors aren't in there, then Blue Preferred Plus is probably the option that you want to choose. Because Blue Priority is a narrower network. And what we're saying by that is that we've gone out, we've contracted with Aurora, with ProHealth, Children's Hospital, and we've said, you know what, let's get in this smaller network. We're going to have more direct involvement with these patients. That's why, we'll talk in a moment about the role that Bo has as your on-site nurse and what that's going to bring to this process. But really what we're saying is we want to do more of a high performance. We expect more and better care from that narrower network because we're going to be more involved in your care day to day than when you're part of Blue Preferred Plus or the broader network. So really that's what you're choosing from. So you can see on the slide here, the Blue Priority Plus, the different networks that are in here, but again, the top 3, 4 are the ones that are in southeastern Wisconsin. So you would be limited to a more narrow network. But again, if you look at, and we'll take a look at the pricing in a moment, it's an opportunity for you to save some money because it is a narrower network. So there's a trade-off there between a broader network and a narrower network. So here's the Blue Preferred Plus map, and again, this is in your books, so if you wanted to just flip to that at some point, you don't have to do it right now. But again, it's just saying, here's our coverage for the entire state of Wisconsin. So if you had a college student and you're like, you know what, I don't want to limit their options, I want to make sure, Blue Preferred Plus may be the way that you need to go. But that's our coverage, through the state of Wisconsin and the groups that participate with us. And I think in the state of Wisconsin, there's only 2 hospitals that we don't have, St. Mary's in Madison and the hospital in Baraboo. The name escapes me right now. But really, other than that, we have all the hospitals in the state of Wisconsin. So the Blue Preferred Plus, and again, I'm not going to go through all of these individual rates. You have a rate sheet that should have been part of your packet. I think it's blue, isn't it, Mary?
Yes.
Yeah. So, or has a lot of blue highlighting on it. So that would give you some idea of the differences between the 4 plans and then what your contribution would be by the tier that you're choosing. Okay, so the Blue Priority Plus option, again, is lower cost to you as well as the narrower network. So you can see by the map, there are some parts of the state we don't have as many providers. So if you compare the 2 maps, you can see the difference between them. But the logos here down at the bottom are just indicating the providers that are part of the Blue Priority Network. So again, we're saying you can have the broader choice for a little bit more money, or you can have a narrower option. And that's what you need to just kind of weigh. What works best for you? That's why we have some of the Aurora folks here today. Is just, if you're thinking about, well, all but one doctor is in Aurora or ProHealth, and you want to consider, well, maybe I could make a change. Maybe I'm not really tied into this doctor. I don't go very often. It might be that you're willing to make that change, and that's what they're here to just kind of help you through that process if that's something that you're considering. And how we came to Blue Priority Plus, just to give you a little bit of background on that, it is really, there's money at risk. I mean, when we contract with Anthem and Aurora contracted also with ProHealth, we said, you know what? They have some skin in the game too, to get some results, to have, good outcomes, to show that if we have this narrower network, a high-performance network, that the outcomes are going to be better. And that's really what Mary alluded to on that first slide, where we talked about the cost savings that we anticipate seeing, that's one of the reasons why, is we think that there's going to be better performance because of that risk sharing. We're using benchmarking, patient collaboration, and that's Bo will talk a little bit about her role and how that will work, the nurse case manager, and that's Bo's role. And that's why we thought that, given the fact that already 73% of the claims that Whitnall had in recent years would fall under Blue Priority. So many of you are already seeing the providers that are in that network. So for a lot of people, that means no change at all. So again, here's the Blue Priority numbers. You can see the difference, in the contributions. And again, I just refer you to the handout that you have. I know you're not going to write all this down. But you can reference that and kind of, again, just determine what's going to work best for you in terms of the plan and then the network that you'd want to choose. Joni, you're up.
Hi, I want to go over a couple things with you. The first thing is, again, we talked about if you have to change doctors, we are back there. There are a few representatives. We can talk to you about what you're looking for in a doctor, openings, things of that nature. We'll be staying afterwards for questions, and we have more information available at the back table. Also, I want to talk to you about this little brochure that's in your packet. This is a new service that we're able to offer to Whitnall, to all the employees. This is called an EAP, which means Employee Assistance Program. This is going to be effective 7/1, along with your medical changes. And I know in the last group, someone's like, that's great, what's an EAP? So to share what an EAP is, there's on the very back, there's a 800 number or an email. It's where you can call in and ask questions around whether it's financial advice, if you're looking for elderly care or maybe child care. If you need to talk to someone about stress or anger management, this is available. If you're working with maybe a coworker who's very frustrating, I think maybe we all have those. No, I'm just kidding. And you need some guidance of how to really connect with that person on an issue, the EAP can help you with that. There's also going to be available to you free counseling face-to-face with this service. And I'll be able to get more details to you. Again, this program is just as a little tickler. More information to come. I'm going to work with Lori and Doug and the HR team and Mary to get that information out to you. All right, thank you.
Hi, as a on-site nurse case manager, my role is to partner with you and your family for any kind of healthcare questions, healthcare needs, help you navigate maybe a new healthcare system. If you're going through changes as far as changing physicians, providers, I can help you find one. We have great resources within our TAP nurse line. As well as having worked within a hospital system, the community as a home care nurse, I have a lot of resources for you. We do activities throughout the year as well with another school system that I'm engaged with right now. We have health wellness activities such as blood pressure screenings, BMI activities. We have speakers that do come to the sites. So a lot of health and wellness activities that we try to get everyone involved in, including your families, if you like. I not only will be on site for you, but also available by email, by telephone. I can meet you at a Starbucks if you like. I do home visits, hospital visits, so I'm available pretty much all the time. And this is just for your benefit. And you don't have to be in the Aurora Health Network to receive my services. You can call me even if you're not in the insurance plan. So my brochures, my email, my cards are on the table back there. Feel free to stop afterwards and ask me any questions. Thank you.
And I will tell you, I do work with Bo in another school district setting, and their satisfaction with how the on-site nurse works has been very high. So, comes highly recommended. So, now just a few more things that I want to touch on in terms of Anthem and coverage and things that are kind of going to go with or come with your plan. And again, these are regardless of which option you might choose. So I think Mary mentioned it before in terms of the breadth of our network. You know, we have more than 90% of the hospitals in the country, 80% or more of the providers across the country. You know, if you think there's a Blue Cross Blue Shield plan in every state. So really, that's where our coverage is, because Blue Cross Blue Shield is an association, and so we share, and we have the ability to what's referenced there in that last sentence, the National PPO or Blue Card PPO network. So if you're traveling, you're in Florida on vacation, and something should come up, there are Blue Card or Blue Cross Blue Shield providers in Florida that, you know, could be available to you. So that's what's really nice about the breadth of our network. And when you get your ID card, you'll see that little suitcase on it that'll actually show up on your ID card, so that if you do have to receive services out of the area, they're going to look at that and go, oh, okay, I know just how to file that claim, and that, you know, they would know, you know, that they're a participating provider. So that's the indicator on your ID card that would indicate that. And then we're also in nearly 200 countries around the world. So if you're traveling internationally and happen to have an incident, there's actually a number on your ID card, and you call that, and they can assist you if you have an international need for care as well. On the, well, I guess it'd be my right-hand side, the Blue Distinction Centers of Excellence, that's just kind of calling out that we do have certain centers where we say, you know what, these people are really good at this particular thing. So whether it's a transplant or a complex or rare cancer, you know, it's a possibility that we may say, you know what, we want you to go to this Center of Excellence because for what you have, we think they're the best place to be. So obviously we would work with, you know, whatever physicians you're seeing locally, but if we think that your case warrants it, it might be that we recommend you go to a Center of Excellence so we can get the best possible outcome for the care that you might need. So you're probably wondering, well, how will I know if my providers are currently in Anthem? So again, these are in your packets. These instructions are in there, so you can reference those later when you have a chance to be in front of a computer. But you're really just going to anthem.com, and over there as you're facing the screen, it says Find a Doctor there on the right-hand side, and then you're going to pick which plan you're interested in. So are you interested in the Blue Preferred Plus point of service or the Blue Priority Plus? And then it has POS or point of service in parentheses. So that's how you're going to just walk through that, and you don't have to log in, you don't have to put in any of your own information, you're really just using it here from the front screen. When you become a member of Anthem, you know, we would request that you set up a profile, so then you don't even have to fill that in. It knows what network you're in, network you're part of, so you can do a search very easily. But at this point, when you're still trying to you know, decide, you know, where are my doctors, are they in or out? You can look that up on the website and, you know, check that out, put that information in. So again, this is just walking through if you, Blue Preferred Plus is what you're going to choose in this drop-down box. There you select Wisconsin, and then it's going to ask you for the network. You're going to put in Blue Preferred Plus. All right, so let's talk a little bit about the prescription drug coverage. Mary mentioned that, and you currently have a preventive drug list on your existing plan. So we're going to do a similar kind of thing, you know, so if you're on a medication now that you're paying a copay, that's something that's on your preventive drug list. But as happens with carriers, just like maybe the doctor list changes a little bit, so does the prescription drug list. So in your books, and again, you can look at this later. On page 32, we have the preventive drug list that is going to apply to Whitnall under Anthem. So you may just want to look at there and go, this is the medication I'm on now, you know, where is it on the list for Anthem? And if it's not on that list, then we also included in the booklet the national drug list, and that's just a few pages later on page 36, that national drug list, that would be all the medications. So medications on that particular list, again on the national drug list, would be those that you're going to be subject to deductible and coinsurance. So if that's what you're paying for your medication now, it's the national drug list that you want to look. So again, your copayments are for the preventive RX prescriptions, the deductible doesn't apply, but otherwise, if it's not on that list, it's not considered preventive, then you're going to pay the deductible and coinsurance. And if you look that over, if you have any questions, those are the kind of things that you can route. I'll be around afterwards as well, or run those through Mary so that we can get an answer. If you're not finding your medication, we'll find out, what the deal is and why it's not on the list or what the equivalent drug might be. So. In your booklets, you'll also find some information about Express Scripts, which is our mail order vendor that do all of our prescription drug administration, but particularly we put mail order information in there for those of you that maybe you're on a maintenance medication where every month you're taking, you're just getting it refilled and refilled. If you're not currently on mail order, you may want to look at that as an opportunity for cost savings, especially if it's something that's subject to the deductible. And if you're not, then there's a form in there. It tells you how to go ahead and get that set up if you have maybe a newer medication that you're like, oh yeah, it makes sense to be on mail order. You can also, there's another part of the prescription drug website that lets you price your drugs or find generic equivalents. So if you want to shop around and say, where could I go? Should I go to Walgreens, or should I go to Target, or where should I go to get my prescription filled? This can help you kind of shop around and give you some idea of what those medications are. Medication prices change almost daily in some cases. So, we usually give you a range, but it might give you some idea, particularly if it's something you're paying for, deductible and coinsurance. You might want to take advantage of the opportunity to just do a little price comparison and see where the best deal might be found. And I mentioned this before, but once you enroll with Anthem come July 1st, you'll be able to set up your Anthem online account. And some of the things, we already talked about the provider search, but you'll be able to look at your claims and your explanation of benefits, estimate your costs. We have that both for the prescription drugs, which I just showed you, as well as medical procedures. So there's some medical procedures, like if you have to get an MRI, and you're like, well, it's not an emergency, so maybe I should shop around again because I have to pay my deductible and find out where might be the best place to go. And you can use that tool, particularly if you're in the Preferred Plus network. You have a lot of options. You might just want to say, well, do I want to pay $600 or $1,500? And you have options. And so that's a great way to educate yourself on the cost of healthcare services in the community. You can reference your medical benefits, your certificate of coverage when that gets published. You can view or print your ID card. Let's say you misplaced your ID card, went through the washing machine or whatever. You can print a new one or requested one be sent to you, so you can do that online. If you do set up mail order, you can refill your prescription. And then we also have a number of special offers, and there's a page in your booklet about the special offers. These are discounts that you would get as being an Anthem member, things like, a discount off of Weight Watchers, hotel rooms, just all kinds of different things. And every time we travel, I at least check it out to see what might be out there and see if I can take advantage of it. So something just to know that's out there. One of the other services that will be available to you is Live Health Online. And Live Health Online is a relatively new service that Anthem's offering. We've had it for a little over a year, but it's the ability to do an online chat with a physician. So through your smartphone, through a tablet, through your computer. It has to be camera enabled. You have to be able to see each other. But it's live video where you're logging onto a website, entering some basic information, choosing a physician from basically a waiting room, and you get the opportunity to talk with them at your convenience. So whether it's at your desk at school or from home or wherever that might be, but you have the ability to connect with them. So without having to, if you have small kids, load all the kids in the car and go to the doctor's office, you can do that. Now, it's not for everything. I mean, we're really talking about more, minor things like cold and flu symptoms, sinus infections, family health questions, my kid's got a weird rash on their arm, they got stung by a bee, how serious is this? Things like that you just, like, wow, I wish I didn't have to go to the doctor's office or wait till Monday to go in, because it's available 24/7. So even if you were on vacation, you could use it. Oh, my kid got a really bad sunburn. Like, how serious is this? What might be some treatments, and the doctor would be able to advise for you. Now, there is a cost to Live Health Online, so it's kind of like, you're having an office visit, you're just doing it remote. And for you, the cost would be $49. So again, if it's subject to your deductible and coinsurance, that's certainly still going to be less than an office visit locally or going to urgent care, or certainly less than going to the emergency room. So it's another option for you, another way to receive care. It's not for everything, but we think it's a nice addition to just, again, give you some options, give you some choices as to where to receive care. In addition to Live Health Online, we also have the 24/7 nurse line, which is free, and that's, you can call them at any time. We just have questions. Hey, I have a new medication, and I'm feeling like, I'm having these symptoms. I'm dizzy or whatever. They can walk you through that. Or you're really not sure, how urgent is this? Is there something that I can do, so I don't have to go to the doctor's office? Is there home care that I can do until my doctor's office opens on Monday? And they can help you assess that situation and just determine, do I need care right now, or is there something I can do in an interim, or, just to treat this myself? So again, you have the 24-hour nurse line, and then Live Health Online being another option. And one of the things I didn't mention about Live Health Online is they can also write prescriptions. So it's not every state allows the online physicians to write, but more and more are being added all the time. And Wisconsin is one that they can write a prescription. So if they decide you have a sinus infection, they can send it to the pharmacy of your choice. You can go pick it up yourself or have somebody pick it up for you. And again, you didn't even have to leave home, and you've got that situation addressed. Okay, a couple of things that I just want to touch on in terms of continuation of care. If you are considering that you're like, most of my doctors are in Blue Priority, or I would certainly consider changing and joining that network, but you have a current medical situation that's working itself out, we do consider what we call continuation of care. And what that is under limited circumstances, we would let you continue care with an out-of-network provider for a short period of time until we can transfer your care to someone else. So an example of this might be somebody who's in their third trimester, and I'll see my doctor at Columbia St. Mary's, but then I'm okay with changing doctors and going and seeing someone at Aurora or Pro Health. So that would be an example. Maybe another person might be, they're just finishing up a course of chemo, and they want to see that through with their current care team. But then again, they're willing to make a change and go to an in-network provider. So it's, again, some limited circumstances that we would, consider those exceptions. And if you have that need, you can touch base with me afterwards, or Bo will have that information on completing that. We just need a form filled out with the information about the type of care and the physicians or hospital that you're being treated at, and then we review that and would let you know if we're going to say, yeah, you can continue with that care for a specific period of time. So we just wanted to let you know that is an option, and if you have any questions about that, again, we can talk afterwards. And these are just the guidelines that kind of go with this. Again, maybe somebody who was recently hospitalized, member's treatment is, in an interim page, end stage cancer, third trimester, and so forth. And I'm going to turn it back to Mary.
Thank you. The decision was made that health savings account contributions would continue for anyone who would be moving to Plan 2, Plan 3, or Plan 4. For a person moving to Plan 2, picking up single coverage, that would be a $300 health savings account contribution. Plan 3, a $600 contribution. Plan 4, $900. And then for all of the employee plus spouse, employee plus child, children, or employee plus family, Plan 2 would be a $600 health savings account contribution. Plan 3 would be $900. Plan 4 would be $1,200. It's my understanding that most of you have health savings accounts set up now at your personal accounts. It would just be continuing to use those accounts and have the new funds direct deposited over the course of the next months, the normal pattern. Health savings accounts are really important, especially with high deductible health plans, because it's really the only way that a person can find some relief in the taxes. that you're paying. And I just always want to remind people about, if you're spending a lot of money for health care, or you just want to find another way to save for retirement, this is a way to do it. And believe me, everybody who has a high deductible health plan should at least establish an HSA, because if you do have that event and it's going to be expensive, the HSA has to exist first, and then the claim. If the claim comes first, you can't submit it against that HSA account because it came before. So for this year, a single person can set aside $3,350 into a health savings account. That amount is not increasing for 2016. Family for 2015 is $6,650, and it is increasing by $100 to $6,750 next year, 2016. And for anyone who's age 55 or more, $1,000 catch-up can happen this year and going forward. So just to remind you, contributions are tax deductible, interest grows tax-free, distributions are tax-free as long as they're used for qualified medical expenses, so you never pay tax on that money. This is your account, so you open it at a bank or a financial institution of your choosing. You take the money with you, so at the point when it's not like an FSA where you use it or lose it. It's not like an HRA where you have to have the expense to be able to get the value. This is money that is yours that you take with you. You can pay medical expenses for people that aren't enrolled on the plan as long as they're your tax dependent. So if dad has one plan, mom has the other, you can use this money for either of you. And it's really important to know that once you're at retirement, you're only paying, just like with an IRA, ordinary income tax on monies that you're not using for a qualified medical expense. So that's a little briefing and catch up on the health savings accounts. So now we're going to move off of medical and talk about dental. The Anthem dental plan is pretty much exactly the same as what you had with Humana. You have an individual maximum benefit of $1,000. What that means is that once you've spent $1,000, then the plan pays nothing. So this is the opposite logic of the medical plan. So you spend it'll pay up to $1,000. There are no deductibles. So when you go in for any visit, you don't have to pay something first. Your preventative care continues to be paid at 100%. We want everybody to go in and get their regular cleanings. Basic services are covered. That's like fillings. You pay 20%. If you're doing something significant, bridges, that kind of thing, that's also covered at 80%. You pay 20%. Prosthodontics, which I always have to think those are bridges, are 50%. You pay 50%. And for orthodontia for your children to age 19, the benefit is 50% up to $1,500. CarePlus Dental is the lower cost option. It is a dental HMO. And we use that dental HMO language because all of your services have to be provided within the confines of the Dental Associates clinics across southeastern Wisconsin. The CarePlus Dental premiums are 15% lower than Anthem's. It's that lower cost option. Your closest Dental Associates office is here in Franklin, or just up the road in Franklin. But there are offices in different parts of Wisconsin. The next, or southeastern Wisconsin, in our communities. The next one is being built near the Woodmans and Waukesha. So there's another one that's coming in probably the next 12 to 18 months. So the benefit of Care Plus is that you're getting more value. And the instead of $1,000, you would get $1,500 of services, and then the plan would stop paying. Again, 0 deductibles. Your preventative is still covered at 100%. Basic services, fillings, things like that, are covered at 100% instead of 80. Major restorative, paid at 90 instead of 80. Prosthodontics, continuing at 50%. Something not on this slide that I want to make sure to say is implants are covered, if anyone needs an implant under the Care Plus plan. And for the families with kids with orthodontia, this is a really big benefit. 50% up to $2,500. So, and they'll have you, that you can come in for free reviews. So if anyone's interested, we can make arrangements for that kind of an appointment to get you in to have your kids checked on. And then lastly, the Blue View Vision Plan. This is not similar to what you had before. It's much better. This isn't the Anthem plan. What makes it better is that your old plan would only allow you to have frames once every 2 years. This one allows you to have a new full set of glasses once a year. So if I have kids who kind of just go through their glasses, it gives you a little bit more value with replacing broken glasses and damaged things. But I think a lot of us are in a place where maybe we have to have a set of sunglasses and a set of computer glasses and a set of reading glasses. So, if you need more than one pair of glasses, this would be a way that you can get that and at a lower price than what you were paying before, because the Humana rates were higher. So Anthem has brought in some more value to you. This is also a tiered plan, so you can pick single, employee plus spouse, employee plus child, children, or employee plus family. And I'm really excited to be able to share with you that Anthem has locked these rates in for 3 years, which is really big from your side and from my side too, because to get things locked in with inflation and whatnot is big. And Joni's already shared a little bit of information about Aurora's Employee Assistance Program, but what she didn't share was probably the most important thing, is that Aurora is really investing in all of you. This is a free benefit to you. They are not charging the school district for their Employee Assistance Program services. Now, why is this important? 6 counseling center sessions are available to you at no charge. If you used your medical plan for 6 counseling sessions, you would be paying deductibles and co-insurance for some of those services. So, if it's something is up, start here. If it's a stress issue or behavioral health issue or something, and all of the other things, just if you want to stop smoking, start here. Free to you, an awesome benefit. Thank you, Aurora. All right, and we'll close it down here. In order for you to have your ID cards by July 1st, we would like everybody to have their elections into Lori by Monday, June 1st. This is an active election. If you don't turn in paperwork, we don't know what you want, so you'll have nothing. So we need to have everybody, even if you're waiving coverage, to please turn in paperwork so that we know we can account for everyone and what they want for this next year. The enrollment form is this stapled packet that was the front page. I want to make sure to also share with you one other important point on here. It is important that for yourself and your dependents, obviously we have your Social Security number because you have to have tax information at the end of every year. But in the past, you haven't had to provide the Social Security information for your dependents. Medicare CMS requires that now for coordination of benefit purposes. But more important than that, at the end of 2015, you will be getting a new form. It's a 1095 form that basically will list all of your dependents, and if they, yourself and all of your dependents, and if they had affordable and minimum essential value coverage for the year, and it's by month. So we have this new reporting requirement, and in order to match all of the pieces of the IRS and HHS and DOL and all of IRS and all the people that are involved in reporting, those Social Security numbers tie it all together. Please be careful with them. Put your enrollment form in an envelope, seal it up. Don't be casual about it, and we'll take care of everything expeditiously. But that's the reason why that detail is being asked for, and it'll be asked for going forward, and it doesn't matter who your coverage is. It's going to be part of this process. Your benefits, as I shared with you, will be effective July 1st. You'll all get new ID cards based on what coverage you select, with one exception. If you're currently on Care Plus, you would not need a new ID card, so you would continue to use the one you have. And I did have one other thought. It is really obvious to me that you all really want to get your questions answered, and that's why all of this team is here. So for anybody who's here tonight, we are here for you to help you get the best value and get, we don't want you to spend money you don't have, so we're here to help you a little bit with counseling on what makes sense for you. We're here to help you with how to find lower cost drugs. We're here to help you. You have not had embedded resources before. Bo is going to be invaluable. I hope that you're like keeping her so busy she can't go to the other school district. Not because you're sick, but because you're not sick. You're taking advantage of her to find the resources to get you the best care, lowest cost, and that you're just thrilled and happy with this transition. So we're here for your questions, and I think it's time to turn off the video. So are we good? Questions good now? Anybody?